After suffering a spinal cord injury, there are a lot of secondary complications that go along with paralysis, such as pressure sores, muscle spasms, urinary tract infections, and autonomic dysreflexia. In this video, I'm going to be telling you about a medical issue I experienced and something I wish I knew a while back that would have prevented it from happening. Hopefully this information is informative and you can use it to prevent the issue from happening to you. Let me know in the comments a medical issue you have experienced since your spinal cord injury and how you resolved it. If you are new to the channel, my name is Ellis and I am a C5 through C7 quadriplegic. I make videos to help you live life just like you would have able-bodied. If you enjoy this video, give it a like and subscribe to the channel so you don't miss out on future videos. I normally have a yearly checkup appointment with my primary care doctor, and I had one in November of 2021. They wanted me to get my blood drawn and have a DEXA scan, which tests the density of my bones, because it had been a couple of years since I had my last DEXA scan. DEXA scans after a spinal cord injury are important because the bones of our paralyzed body are weaker, which makes them more likely to break. They told me that my DEXA scan results showed I had weak bones and suggested I take calcium and vitamin D3 supplements, which I was already taking. I got to looking at the bottle of calcium supplements that I was taking, and it said to take 2 tablets per day, which I'd only been taking 1 tablet per day ever since I started taking them a few years ago. So I increased it to 2 per day, thinking it would help the density of my bones, since that's what it said to do. Then about a month later, around January 10th, I started getting hot flashes that were lasting between 5 minutes and 2 hours, and would get 1 to 5 hot flashes per day. I am normally cold due to my spinal cord injury, not allowing my body to regulate its temperature, and I wear a sweatshirt and toboggan in the winter to stay warm. However, these hot flashes were causing me to sweat and would sometimes get so bad that I would have to take my sweatshirt, toboggan off until it went away. There was nothing happening before these hot flashes that I could link to as to what was causing them, because they would just happen randomly. I assume these hot flashes were part of autonomic dysreflexia, or AD, which tells me that something is wrong below my level of injury, since my body can't communicate with my brain due to the signals being blocked where my spinal cord injury is. And I thought that a urinary tract infection, or a UTI, could be what was wrong, but normally if it's a UTI, I will leak, but I wasn't leaking, and I will get painful AD headaches, but luckily there was no pain with these hot flashes. So I had a urine culture done on January 14th, but it came back negative. The next week, on January 20th, I did an at-home COVID-19 test, and it was negative. I posted on the Spinal Cord Peer Support USA Facebook group, which is linked in the description of all my videos, detailing what was happening, and asked for thoughts on what could be causing the hot flashes. Some members of the group were suggesting it could be kidney stones, which made sense to me. So on January 24th, I went to my urologist to have a CT scan to check for kidney stones. The CT scan did not show any kidney stones, but it showed that I had some waste backed up in my large intestine, which is normal for people with spinal cord injuries, because it takes our digestive system longer, to digest food. And my urologist did a urine culture, which came back negative, and also did a PCR urine test, which looks at the DNA of your urine and is more accurate and has quicker results. instead of having to wait for a urine culture to grow bacteria. My urologist prescribed me Bactrim, which is an antibiotic, until we get the PCR urine test results back, and I took one on January 25th. My urologist called me with the results of the PCR urine test and said I had a small amount of bacteria in my urine, which I always have due to using catheters, and prescribed me to take one Levaquin, which is an antibiotic that targets the specific bacteria I had, per day for 14 days, which I started on January 27th. I did that and was on my last day, but was still having hot flashes, so they prescribed me to take one Levaquin per day for another 10 days, which I started on February 10th. After that, I was still having issues, so they suggested I take a half dose of Bactrim for 3 months to assure the bacteria was killed. To help with the hot flash symptoms, they prescribed me to take one doxazosin for 3 months, and doxazosin treats high blood pressure, which is what autonomic dysreflexia is, and they also suggested I take a probiotic to help with my digestion, since I was going to be on an antibiotic for so long. I started all of this on February 21st. On March 9th, I woke up and was having autonomic dysreflexia, which included a really bad AD headache. My whole body was spasming and I was sweating. I went to the emergency room and they took my clothes off, took my temperature, blood pressure, did a urine culture, which was going to be inaccurate because I was already on antibiotics. Gave me 2 Tylenol and sent me home. Nobody notified my parents in the waiting room about what was going on, and I asked the emergency room doctor if they knew what AD was, and they said yes, but I still explained it. My report stated autonomic dysregulation and paralyzed T6 down, which is inaccurate. The doctor said I needed to follow up with my primary care doctor and get set up with a neurologist, and it appeared to me that my issues did not warrant a need to go to the emergency room. There was no attempt to see what was causing my AD, which is fatal if not addressed. I had the follow-up appointment with my primary care doctor on March 14th and got a referral to a neurologist, but the soonest I could get in was a couple of months away, and I did get on a waiting list and got an appointment sooner, but by that time I had already solved the issue. At this point I was constipated, I had compaction and was forced to dig it out, and was bleeding during my bowel programs every night. I thought that this could have caused a hemorrhoid since I was bleeding. This whole time of not being able to go during my bowel program like normal, I was eating oatmeal, shredded wheat cereal, fiber bars, bananas, and other fruits, vegetables, and beans every day. I was taking Cineplus, which is a stool softener that I've been on ever since being paralyzed, a probiotic, magnesium to help with softening my stool, and I even tried Miralax, but was still compacted. I also doubled the amount of water I was drinking per day. I decided that the Bactrim was causing the constipation to be worse, so I stopped taking it on March 16th. And I also stopped taking the doxazosin because I was still experiencing AD. On March 29th, I didn't have any blood during my bowel program, which was the first time in a few weeks. Then I was trying to figure out what caused the hot flashes, which I figured was being caused by being constipated. So what was causing me to be constipated? I was thinking about the only medication I was taking at that point, which was a stool softener, magnesium, and calcium. I searched the internet to see if calcium can cause constipation, and this is what I found. Most calcium supplements cause constipation because they supply only calcium or just calcium and vitamin D. It takes a variety of nutrients for proper absorption of calcium, especially magnesium. Magnesium is a natural laxative and thus counterbalances the constipating effects of calcium. If your calcium supplement and or your diet lack magnesium, then constipation can occur. But with enough magnesium, your colon walls will relax, helping you pass stool along. Additionally, magnesium attracts water, meaning more water gets to your colon and softens your stool. On the flip side, calcium contracts muscles. If you're getting too much calcium, the muscle walls of your colon contract, making it harder to pass stool. The longer your stool sits in the colon, the more water is pulled out of it. This makes the stool dense and hard, making it significantly harder to pass and likely painful. The proper ratio of calcium to magnesium is 2:1, so 2 parts calcium and 1 part magnesium. After finding this information, I stopped taking calcium supplements on April 2nd. I started Miralax the next day to help get things soft and back to regular. I called my primary doctor's office on April 6th, telling them about my constipation issues, and was prescribed Linzess, but my insurance denied to pay for it, so I didn't get it. I then called back on April 8th and said I wanted to be referred to a gastroenterologist since I was having digestion issues. My doctor referred me to one and suggested I have a colonoscopy done, but the soonest I could get in was several months away. Since I solved the issue, I do not plan on having a colonoscopy done anymore, but I am still scheduled for an office visit with a gastroenterologist to ask some questions. On April 9th, which was 1 week after stopping calcium supplements, my stool was soft, and on April 25th there was no blood in my stool. It took almost 4 months for me to figure out and resolve what was causing my hot flashes. It cost me several $100s to pay for medicine, tests, doctor appointments, emergency room care, and many other factors. If I had not taken the initiative to solve this on my own, I doubt any medical professional would have come to the solution to this day. All this could have been avoided had I known that I should be taking magnesium with calcium supplements. However, I had been taking calcium supplements for a few years but did not experience constipation issues, which I guess is because I was only taking 1 tablet instead of 2. The calcium supplement that I was taking included 600 milligrams of calcium per tablet to increase my bone density, and 20 micrograms of vitamin D3 per tablet to help my body absorb the calcium. After this medical issue, I found calcium supplements that also include magnesium to help prevent constipation. Some other side effects that I was experiencing during this time were an increased swelling of my feet, so I started wearing compression socks that I ordered off of Amazon, and my eyes hurting when I would look to the sides. I'm assuming both of these side effects were from all of the medication I was on, because I was taking a lot more medication trying to get things solved, and it turned out medication is what caused the issue to begin with. I've always been on the mindset of being on the least amount of medication as possible. I know this was a long explanation, but I hope you found the information informative and you can use it to prevent the issue from happening to you. Don't forget to let me know in the comments a medical issue you have experienced since your spinal cord injury and how you resolved it. If you enjoyed this video, give it a like and subscribe to the channel so you don't miss out on future videos. Thank you for watching, and I hope you watch another one of my videos.